It's the hot holiday item for the second year in a
The
row.
website said it was open, but they're clearly not.
COVID tests are available if you can find an open location.
I could pay to get a test at least, like that's my last hope.
Nikhil needs to hop on a flight
Yeah.
if he can find a test to get him there.
So I was trying to get a RT-PCR test to travel to Canada since I need to get it 72 hours and it's Christmas Eve. It's really hard to find a test. Lakewood, like near Cherry Creek.
I'm lucky I don't have like crazy intense family plans right now, but I feel for the people that do.
Stephen isn't flying anywhere. He just wants peace of mind.
It's more just being kind of like responsible as I can. We're supposed to see friends and tonight and tomorrow, and they have kids.
Even if you're not worried about your own health for whatever reason, to be worried about the health of those around you.
Dr. Jean Kuttner is the chief medical officer at UC Health, where healthcare workers were getting the first vaccines this time last year. But today, there's still a real concern of hospitals reaching capacity.
Now that we're seeing increasing positivity rates across the state, then we would expect to see more people continue to be infected for about another week or so, and then hospitalizations, we're looking ahead to probably the second week in January at this point.
What happens then will be dictated by what we do today. Ahead of packed Christmas church services, Dr. Kuttner recommends a higher quality mask than just a cloth mask.
This time next year, are we having this discussion?
Boy, I hope not. I hope that by next year, COVID is one of the many things that we see and treat, and that it is not dominating what we're focusing on either in our private lives or for those of us in healthcare. By next year, I hope that we're talking about sports or skiing or something else.
Don't we all? Dr. Kuttner points out that it's those who are unvaccinated and who have yet to receive a booster that are most susceptible to getting infected. And if you find yourself possibly exposed, let's say today, your testing window isn't until this time next week, pretty much around New Year's Eve. It's about 5 to 7 days after the potential exposure. So picture your plans, Jenny, this weekend, next weekend, and know that it's another week after those plans when you would get tested if you think you're exposed to know where you're at.
Definitely not convenient nor fun going into the holiday weekend. Yeah.
No, but it's part of what we're used to, at least I don't want to call it an annual event yet, but let's not be talking about this next year.
Oh, gosh, I hope not. All right. Thank you, Marshall.